Welcome you to our YouTube channel, and today I'm shooting this video with the beautiful Jocelyn all the way from Ghana. Jocelyn, you're welcome to our channel.
Thank you.
I understand you an expert in sonography, and not only being an expert in sonography, but you're also an expert in scanning pregnant mothers. From your point of view, introduce yourself to our viewers and then we shall start.
Okay, I'm Roslyn, an ultrasound tech in the US.
Yes.
Yeah, I'm from Ghana.
You're from Ghana. How is Ghana?
Good.
Tell us, how is Ghana? How is Ghana? What's beautiful in Ghana?
We have beautiful people.
Yeah.
Our food are nice.
Yes.
Everything in Ghana is beautiful.
Everything in Ghana is beautiful. Well, Ugandans, you've heard. She's saying everything in Ghana is beautiful. I hope, we shall know. So back onto our topic. For so long we have been looking at the role of ultrasound in pregnancy, in detecting abnormalities and in so things. But today we are looking at after studying and examining a lot of things, we've come to discuss that actually a lot of issues people have with pregnancy come due to the fact that they didn't prepare well for this pregnancy. So, as a sonographer, how would a woman that is planning to have a baby maybe in 6 months, maybe in 3 months, prepare herself using ultrasound to make sure that by the time they have this baby, their bodies are all set? What are some of the things that they are going to look out for, and what are some of the things that you think this lady that is planning to be pregnant or to become pregnant in 3 to 6 months is going to look out for when they come for scan?
Okay, so pregnancy is just like inviting a visitor to your home or your place of work or anywhere that you find yourself.
Yes.
Okay, so when you are inviting somebody, you first have to prepare the environment and then know that, oh, okay, this person that I'm inviting, is the person coming to sleep? And then even if the person is coming to sleep, are you going to get a place for the person to stay for that number of time? Yeah, so when you are preparing to get pregnant, you first have to know your body. So ultrasound would help you to see what is in you internally, because as we are walking, we just see our beautiful face, our beautiful bodies, but we don't know what is inside of us.
Yes.
So first of all, you have to know, where is this person that I want to invite to my family? Where is the person coming to stay? That's
Exactly.
So you have to know whether the womb is in good shape.
Yes.
Whether you don't have any anomalies or pathologies.
Yes.
In the reproductive system.
Yes.
So you would have to take a scan,
Yes.
being able to know how your womb look like, whether your ovaries are fine,
Yes.
whether your cervix is okay,
Yes.
whether the adenosines are okay,
Yes.
whether you don't have any congenital pathologies or congenital anomalies, to be able to accept the baby and carry the baby to term. Because obviously when you just get pregnant and then you have these pathologies and these anomalies, you will have challenges, and then you might not be able to carry the baby to term. And then the main goal of the pregnancy is to carry the baby to term and then give birth to the baby successfully.
Okay, so in other words, you are trying to tell us that the reason for this scan that we want to do is to see if the place where the baby is going to be, which you're calling the womb, another person may call the uterus, is actually having the right space to carry this baby, right? So what are some of the things that what are some of the things that we are going to look out for on this uterus as we are doing this scan to make sure that, what are we going to look out for when we are checking this house, the womb or the uterus where the baby is going to sit.
Okay, so you have to check whether the person is not having any fibroid.
Fibroids, yes. Can you
Is
elaborate more about fibroids? To people watching us from Uganda, this is the beautiful Jocelyn. Please subscribe. Jocelyn has said it is important for us to check the womb. Now, the womb or the uterus, in Uganda, I think uterus jetuyita nabana. So Jocelyn is saying we need to look out for ebintu ebisobola obeera mu nabaana nga bisobola okujjamu olubuto. Era essaawa zino she's going to talk about fibroids. Agenda kwogera ku bizimba bya nabaana bye bayita fibroids. Yes, Jocelyn. Okay, that was Uganda. What's your mother tongue? Which tribe do you come like in Ghana?
Anakan.
Okay, all friends from Ghana. Beautiful Jocelyn is representing Anakan. Of course, I'm from Uganda. I'm Muganda. The language I speak that is not English you hear in this video is Uganda. So, Anakan, which language do you speak? Chi. What do you call uterus in your language? Audie. So in her language, uterus is called audie. In my language, it's called nabana. In the Englishman's language, it's called the uterus or a womb. So let's proceed. Tell us more.
Okay, so we have types of fibroids.
Yes.
Some cannot prevent you from carrying your pregnancy to term.
Exactly.
And then some can also actually prevent you from carrying your pregnancy to term. So depending on the size and then the location of the fibroid, that's where that the problem might be. And then you cannot use someone's experience to talk for yourself.
Exactly.
Especially when it comes to fibroid. Because there might be someone with a very huge fibroid and then will still have a baby and be able to carry the baby to term.
In other words, what you're trying to say, Jocelyn, is that I can have a fibroid, or my wife can have a fibroid bigger than that of my neighbor, and she's able to conceive. And then you have a small one, but you cannot conceive. How is this so? Is it on the location?
Yes, it's the location. But fibroid cannot be the only factor that can prevent you from conceiving.
Okay.
So what I was saying is being able to carry the baby to term.
Yes.
Okay. So if you are not being able to conceive, you can't only put the problem. You can't only associate the problem with only fibroid because there are a lot of things that you have to look out for.
Oh yeah. So okay. So as a couple planning to have a baby, you're recommending that we do an ultrasound scan to check out for fibroid as one of the causes that may, number one, stop you from conceiving, number two, implantation, number three, but also may push the baby out as we go on. Okay, what other thing can we look out for? What other thing can we look out for on a uterus when which you think is important during that time when we are preparing? Because, ladies and gentlemen, we are not talking about a pregnant lady. We are talking about a young lady or a couple or a woman or a mother that is planning to have a baby in 6 months. How do you prepare yourself? We've discussed a lot of things. We've looked at diet, we've looked at exercise, we've looked at different tests to be made. Today we are diving deep into ultrasound scan. And yes, point number one is you need to check your uterus because that is the house where the baby is going to be. Point number two, what else do we need to check out for?
To check out to rule out congenital anomalies.
Congenital anomalies. Please tell us more. What are congenital anomalies? And in a simple terms, because I mean, we are not talking to a group of medical experts. This is information for the that woman in the village that doesn't know terms. So we are trying to avoid all the strongest medical terms for our local people to understand. Tell us more.
Yeah, there are certain diseases that are associated with the womb that people are born with.
Okay. So, congenital anomalies, these are, I mean, someone is born with that disease, with what, that condition?
Yeah.
But maybe they never did a scan, they don't know it has.
Know.
Okay.
Yeah.
What are some of them? Like,
we have some that have 2 uterus.
oh,
Bodies.
good. So, in this case, she's saying some of you have 2 uterus. I mean, you have 2 uterine body. It is 1 uterus, but it olinga ina nabana biri mundomu. Another one?
We have some that have I don't know how to explain this
Yes.
for a layman to understand.
Medical term is what?
So we have biconnuate.
Biconnuate, yes.
Yeah. And then
Biconnuate is one that has 2 horns separate. Okay.
and then we have what do we call this one? The one with 2 cervix.
Oh.
2 uterine body.
Yes.
And then 2 vaginas.
Wow. Wow. 2 vaginas. So Jocelyn is saying that the other reason we need to actually to check out for on the scan is that some of you have uteruses that have abnormalities. For example, you have 2 vaginas, you have 2 cervix, you have 2 horns. So Jocelyn kyanyonnyola wano agamba nti abakyala abamu mulina okucekinga nga temunnafuna mbuto lwa nsonga nabaana zammwe zirina ebintu bibiri. Oyina obukyala bwa mirundi 2 oba vagina 2, oyina emimwa gya nabaana oba cervix 2 n'ebintu bya bibiri. Kakati weetaaga okukola scan abasawo okutegeera ofaanana otya munda. What is the third thing that we could actually look out for?
We have some people that can have uterine agenesis.
Hey.
They can have the vagina all right and then the cervix, but there is nobody.
So Jocelyn agamba nti waliwo abakyala nga mulina obukyala n'omumwa gwa nabaana naye nga munda temuli nabaana. Wow. Okay, apart from the uterus, Jocelyn,